Hi, everyone. Thanks so much for joining me once again for our new series on the healthy heart, healthy brain. This series is near and dear to my heart because I spent most of my healthcare career in cardiology. And today I want to build on this series that we're getting from the book Healthy Heart, Healthy Brain by Dr. Bale and Dr. Doneen. And today we're going to talk a little bit more about the number one killer of US adults. Okay. Now, last week we talked about how to assess your risk. We did a questionnaire and assessed and gave you different points, values, and kind of let you know where your risk factors fall and what those numbers mean. So if you didn't get to see that one, that's important because we're looking at several different things now that we didn't used to consider in risk factors for heart disease and arterial disease. Your arteries are the vessels that feed the oxygenated blood to your body's organs and tissues and muscles. So we're talking about arterial disease is disease of the arteries anywhere in the body. It can be your brain, your heart, or anywhere. Okay. And the first part of this series, we kind of went into a little bit about what our arteriology is, and it's that holistic approach to preventing heart disease, arterial disease, and different types of dementias. Okay. And last week I said we did the assessment of what your risk factors are and where you fall in the point value of how high a risk you are for developing these diseases. And today I want to go over a little bit more on statistics and kind of tell you about their 6-step plan. And just for those of you who don't know, my name is Linnea Baker. I'm a board certified family nurse practitioner. I'm grateful for you for showing up and taking time out of your busy day to listen to what education I'm bringing on this topic. So first, in their book by Drs. Bale and Drs. Doneen, there's a quote from the Wall Street Journal. Today's heart disease victim is vastly different from the classic patient doctors and the public were trained to recognize a half century ago. A smoker, usually male, whose LDL or the quote unquote bad cholesterol numbers were sky high. Now the patients are younger, more obese, and much less likely to be smokers and include more women. I can attest to this. We call it now more of a cardiometabolic disease because we're seeing patients in clinic. When I was in cardiac and electrophysiology and in the clinics working with heart patients for quite a while in my career, including as a nurse practitioner, we're seeing sicker and sicker patients that have all kinds of different types of chronic diseases. They come in with lung disease, diabetes, obesity, kidney disease, high blood pressure, high cholesterol. They are sicker than sick, guys, and they're coming in younger. And so I wanted you to be aware of what all of us in healthcare that are seeing these types of patients realize, because if we know better, we can do better. And so really, I want to bring education and awareness to what's going on so that you can advocate for yourself and be empowered to have these discussions with your own personal healthcare provider to find ways to help lower your risk factors, to help prevent these chronic diseases from happening. Okay. So there's some really shocking statistics out there that I want to cover, and this comes from the book Healthy Heart, Healthy Brain, pages 26 through 27. They say that a person diagnosed with diabetes, guys. Now listen to this. Remember, I've told you about half of the adults in the United States are either pre-diabetic or diabetic, and they don't even know it. So a person diagnosed with diabetes is at as high a risk of having a heart attack as a non-diabetic patient the same age who already had one. How powerful is that, guys? Because diabetes is such a huge issue in our country, and it's something I cover quite a bit because we see it so much, and I'm trying to educate and empower you on ways to improve your health and take control of these diseases. So that you have a better quality of life and a health span that equals your lifespan, right? And now that people with diabetes are at just as high a risk of having a heart attack as somebody who never had diabetes who already had a heart attack and is at the same age as them. That's just mind-blowing. Obesity is now considered to be the new smoking. Another shocking statistic. Obesity is now considered to be the new smoking. We said about 70% of Americans are either overweight or obese. So 42% of Americans age 20 and older are obese, 32% are overweight. So that's about 74% of the population, guys. 3/4 of our population has a weight issue. Cardiovascular disease now affects nearly 1 in 2 adults in the United States. Nearly 1 in 2 adults, half the population. The root cause of these statistics is the increase in lifestyle-related diseases, obesity and diabetes. So lifestyle-related, that's what we're eating. Are we sedentary or are we active and exercising? What's our stress? Are we drinking water? Do we sleep? Do we smoke? Do we drink alcohol? All the things, guys. That's our lifestyle and how we live is what sets us up for these chronic diseases like obesity and diabetes. And those are the leading causes of the #1 killer in the United States, cardiovascular disease. And that's exactly what I said there. Cardiovascular disease is the leading cause of death in the United States. So what that tells me is we have a way, knowing that it's a lifestyle related disease leading to this, there are things we can do to impact this and help ourselves, okay? So approximately 6.5 million Americans 40 years old and older are affected by peripheral arterial disease. And peripheral artery disease is the narrowing of the arteries that transport blood from the heart to other parts of the body. Guys, I'm talking about this because, again, it's another type of disease of the arteries that's remember I said before, all the arteries in our body that can carry the oxygenated blood are all made up of the same material, whether it's in your heart, your brain, your neck arteries called the carotid arteries, your femoral arteries in your legs. All the arteries are made up of the same type of blood vessel lining. So if you have disease in one area of the arteries in one organ of your body, like your heart, you have coronary artery disease, well, it sets you up for risk factors for artery disease anywhere else in your body. And I'm seeing more and more peripheral arterial disease. I used to work in the neurosurgical ICU, and I used to recover people who had surgeries called FemPops, which were bypass surgeries in the legs to reroute the blood flow because of the plaque buildup in their legs. And I will tell you, my mom ended up with an amputation because of peripheral arterial disease and some complications she had after surgery. So this is near and dear to my heart. And that's why I want to talk about it and make sure that we're aware of it. Because remember, know more, know better, do better. If we know better, we are empowered to do better. So it all starts with being educated on it. So I'd be remiss if I didn't go through like what atherosclerosis is. I don't want to assume everybody understands. I get a lot of questions on this from clients. They tell me they go to a heart doctor or they go to a vascular specialist or they go to a neurologist for their neck arteries and they don't understand when they're telling them they have plaque or they have blockages or what atherosclerosis is. So let's cover that a little bit so you understand what your providers are talking about. Atherosclerosis is the buildup of the cholesterol plaque inside the artery walls, okay? And atherosclerosis, that cholesterol plaque in the artery walls, that's the leading cause of that peripheral artery disease, like when you have disease in your femoral arteries or in your legs. Atherosclerosis also affects the arteries of the heart. That's known as coronary artery disease. So see how it's all similar? It's still the same cause, atherosclerosis, the cholesterol plaque building up inside the artery wall. And depending on where it's located is what it's called. So when the atherosclerosis builds up in the arteries of the brain, that's called cerebrovascular disease or carotid atherosclerosis. So that's when you have the plaque in your neck artery. And then when you have the atherosclerosis affecting the smaller blood vessels, such as when it affects the arterioles or capillaries, that's called microvascular disease. So I just wanted you to have a little bit of understanding of the definitions and what we're talking about, because a lot of providers, we toss these words around, and I want to make sure you understand what they're talking about, because again, it's part of educating you so you understand what's going on with your bodies or what you're at risk for. So in the book, Healthy Heart, Healthy Brain, they say that the optimal lifestyle is one of their cornerstones of arterial health assurance for life programs. And it's part of their evidence-based prevention plan, okay? And remember, arterial health assurance for life program is this all-encompassing arteriology, where they have this holistic approach. They use Western medicine. They're very holistic. They use lifestyle to empower us to get more information, to take better care of ourselves, to understand what all risk factors we may have that could be leading us towards a higher chance of having these chronic diseases, and also that they're so prevalent in the United States. We need to be very educated and aware. So this is all coming from that book. And arteriology is this new medical specialty that's holistic. It encompasses all the things. Remember, we said normally what happens is a person goes to a cardiologist for their heart. And if they have strokes, they go to a neurologist. And maybe they have an endocrinologist who monitors their diabetes. But what we're seeing is all these diseases are similar and overlap. And instead of putting you in boxes, we want you to have an all-encompassing holistic approach. And that's the approach of this book and where arteriology is coming from. And that's what gets me so excited about what's out there and available to us. So in the book, they talk about a 6-step prevention plan for arterial health assurance for life program. This is what they do. And they use the acronym EDFROG, so you remember it. So the E means education, D is for disease, F is for fire, R is for root cause, O is for optimal care, and G is for genetics. And this is part of what they talk about in preventing these chronic diseases, is their approach to tackle this. So we're going to go into those 6 steps in more detail next week. I didn't want to take too long. I know your time is valuable. So today, how we're going to end, next week, we'll start with those 6 steps and we'll go through each one and tell you kind of what they're talking about with each one of those EDFROG acronym words, starting with education. But first, they do end this chapter with an action step about gathering your family medical history. And I do feel that's very important and empowering. The more you know about your family history, the more it will help you towards being proactive in taking care of yourself and getting on track to prevent these chronic diseases that may be something that run in your family. So just because you have a genetic family history of these things does not mean that you have to have the same outcomes. And that's part of what's so empowering about this book and what they're teaching us in arteriology and in the Arterial Health Assurance for Life program. So when you get your family medical history, they want you to have at least 3 or more generations. So you start with your parents, your grandparents, any siblings you have, any children or grandchildren you have, your aunts, uncles, first cousins, nieces, and nephews, as much information as you can get on these. Include, if you can, their date of birth, just basically which decade are they in, what's their ethnicity, are they male or female, and what was the type of medical condition and what was the age of onset. For instance, I know my maternal grandfather had a stroke in his late 30s, okay? And I know that he was a smoker and he had high blood pressure and high cholesterol. So that would be something that goes in my medical history for my family medical history. But it's also important, and we're going to talk more about this, about family members that had different dental disease, such as gum disease. Losing teeth is a big one, and having different types of infections in their teeth and in their mouth. So I know that my father has really poor dental hygiene. He grew up very poor without dental care, and he's had lots of work done on his teeth. And he's also had heart disease earlier in his life. So that's important in my family history to know, okay? Then also anyone who's had pregnancy complications, whether it was gestational diabetes or high blood pressure, or any complications with pregnancy, that's important to know, because when we're pregnant, that's a stress on our body. And that tells us how our bodies are handling those stressors, and we know what to be looking for later on, okay? We want to know if there's any mental health conditions in the family, as well as any red flags for heart disease, stroke, or dementia. We're going to talk about those red flags coming up, or you can go ahead and purchase the book, and I'm going to go through that in just a minute, and you can look at that sooner than I'm going to be covering it. And then lifestyle. Do they smoke? Were they using drugs, any kind of substance abuse? What was their diet and lifestyle and exercise like? Were they sedentary? Were they a vegetarian and an Olympic athlete? Were they a college athlete? Did they have a very sedentary job and smoke all the time? Did they drink alcohol on a regular basis? Those are all things that help your provider know in the medical family history. And then if one of your relatives has deceased that's in this kind of generational family history that you're getting, what was their age and cause, age of death and cause. And I know that's very hard to talk about in so many instances when we talk about our loved ones, but they leave us information that we can use to not only help ourselves, but help the generations to come in our family, your children, your grandchildren. So I know it's not an easy thing to discuss. And I do understand that, but when we get some of this information, or as much as we can, and sometimes we can't get that, and we understand in healthcare that happens too. But if you can get some of this is information that would be beneficial for you to know, to write down and have documented to share with your healthcare providers. Okay. And that being said, I just want to remind you guys, I am on a mission to positively impact your health and wellness through education and coaching, to create generational health and a health span that equals your lifespan. Let's change the outcomes of what's been going on in generations past, and let's get the knowledge and empower ourselves to be proactive and prevent some of these chronic health conditions plaguing the United States. Let's have high quality of life. Let's set the standards for our kids and our grandchildren, because we know more is caught than taught. They're watching us. And let's have a high quality of life instead of living with a chronic debilitating disease that limits what we're able to do towards the end of our lifespan, because that's what gives us that health span, that quality of life. If you have questions, or you're frustrated, or don't know where to start, or you're interested in hearing more, please reach out to me for a free health consult. You can do that by commenting below or private messaging me on Facebook. I'd love to hear from you and talk with you more. Remember, this is educational. I am not here to replace any guidance by your personal healthcare provider. I'm giving you education to empower you to have discussions with your personal healthcare provider who knows you best. And again, if you have questions or want to know more, please feel comfortable reaching out to me so we can have a conversation, okay? And this is the book that I'm getting this information from. It is phenomenal, guys. It is evidence-based. Lots of what they've done is published in the research. It's Healthy Heart, Healthy Brain by Dr. Bradley Bale and Dr. Amy Doneen. And I bought this book on Amazon after hearing Dr. Doneen on a podcast that lit me up about what she offered and what she's done in her research in this realm. And like I said, this is a passion of mine, because the majority of my healthcare experiences has been with more cardiology, cardiovascular disease, and end of life. And it breaks my heart to see people suffer. And this is a way we can educate each other on what to look for to help make an impact on our overall quality of life and health. Okay. So please, this is written in layman's terms. It's a powerful book. I'm only taking a few snippets out of it. There's so much more in it that can bring value to you. So don't hesitate to get that from Amazon or wherever. I'm not sure where else they're selling it. That just happens to be where I bought it. And then next week, guys, please join me for the next part in this series on Healthy Heart, Healthy Brain. We will be covering the 6 steps, the EDFROG acronym that I brought up today. We're going to start covering that next week on our next part of this series. So until next time, please be safe and know that I'm so grateful for you for giving me some of your valuable time. And I hope this brought value to you and educated you on some things that can empower you in taking control of your own health journeys. Okay. Take care. Again, be safe.